I am Dr. Kondalrao, cardiologist, senior interventional cardiologist from Pratima Hospital. Today we are going to discuss about the bypass surgery, when it is going to indicate it, what are the complications, what are the various procedures, and how much it takes to recover from the bypass surgery, and what are the precautions you have to do rehabilitation after bypass surgery we are going to discuss. Heart disease is the leading cause of the death all over the world, including India. You know that heart disease is caused by various factors like smoking, hypertension, diabetes mellitus, and high cholesterol, and a sedentary lifestyle, and stress. These are the causes for the heart attack. Once a heart attack occurs, how you are going to treat the patient? There are two methods are there. One is angioplasty, that is without surgery. Second method is to do the bypass surgery. Bypass means coronary artery bypass surgery. Bypass surgery is indicated if the blockage in the left main is more than 50% or 70% blockage in the major 3 blood vessels, or more than 70% block in the left anterior descending artery. These are the indications for the bypass surgery. Bypass surgery is the operation which is done by the CT surgeon, and the average operation time takes around 3 to 4 hours. Sometimes it is more than 4 hours also. In bypass surgery, what we are going to do is we'll intubate and then give the anesthesia. We'll open the chest and take the blood vessels from the leg or chest. Then we create the new path to supply the blocked blood vessels. Actually, we are not going to do anything with the blood vessel, blocked blood vessel. We are going to create the new path or new vessel connect to the blood vessel distal to the blockage. This is called bypass surgery. For example, if the road is blocked or congested, the traffic is more, what we are going to do? We create the new road, that is called bypass road. Here also the blood vessel is jammed, and we take the another blood vessel from the leg or chest. We connect from the aorta to the vessel distal to the blockage. This is the bypass surgery. There are two methods are there for bypass surgery. One is beating heart, another one is on pump or off pump bypass surgery. In on pump, we will connect to the heart lung machine. Then we stop the heart by giving the potassium solution. Then we'll do the bypass surgery. The second method is off pump, that is beating heart. We'll use the octopus to reduce the movement of the heart. We connect the bypass grafts from the aorta to the blocked blood vessel, either to the LAD, RC, or circumflex artery. So the advantage of the beating heart versus bypass surgery I'm going to discuss. On beating heart, this is the usage of the blood products or blood transfusion and is less. The recovery is very less compared to the on pump. On pump will connect to the heart lung machine. So it depends on the indication. We'll use whether patient should go for the on pump or off pump. It depends on the surgeon's choice. And the recovery also very less with the off pump, that is on beating heart. So after bypass surgery, how many days it is required to recover from the bypass surgery? Actually, we'll keep in the ICCU for 4 or 5 days, and then we'll shift to the ward. Then probably in 5-6 days we'll discharge the patient. After discharge, what precautions we are going to take, and how many days you have to take the bed rest. After surgery, actually it takes 6 to 12 weeks to recover completely. Some patients recover very fastly, and some patient it may take longer time to recover from the bypass surgery. And once bypass surgery is there, depends on your exercise and dietary habits, you recover very completely, and you can lead the normal life, including the sexual life also. So how you are going to start the rehabilitation of bypass surgery? Do the exercise at least 5 to 10 minutes twice a day, and every day increase 1 to 2 minutes or 2 to 5 minutes, and escalate exercise time. By that you can achieve the full exercise capacity over a time. And what dietary and the foods which causes the constipation you should avoid. The food should contain the proteins, and fats and carbohydrates in prescribed ratio. And it's better to take the soft diet initially after the bypass, and later you can take the semi-solid or solid. And what precautions you have to take is clean the wound with the soap water, and make sure that wound should heal properly. If you are a diabetic, good control of the diabetes is important. Continue the hypertensive medication if you are a hypertensive. And the blood thinners are very important after the bypass, like aspirin, clopidogrel is indicated by the surgeon, and cholesterol tablet is indicated for the lifelong. Initially we'll give the high dose, and later we'll give the small dose like 10 milligrams, 20 milligrams of atorvastatin or rosuvastatin. And the myth is once bypass surgery is done, probably you will become very weak. It's not, notion is very wrong. You can lead the normal life after going for the bypass surgery. Bypass surgery is the good alternative to the angioplasty. If there is 3 blocks are there, definitely you can go for the bypass surgery. After bypass surgery, usually it will come for the 10 to 15 years, and the routinely will recommend the total arterial revascularization. Means you use the total artery, means the blood vessels which carry the good blood, oxygenated blood, that's called the arteries, and bad blood, that is the veins. So it's better to connect the artery to artery, that is called total arterial revascularization. We have the 3 arteries in the body to use for the bypass. One is right internal mammary artery, second one is the left internal mammary artery, third one is radial artery. And depends on the choice of the surgeon, they will take whether to take the right or left internal mammary artery or radial artery. If the veins are not available, you can go for the gastroepiploic arteries or veins, and you can use as a bypass. The difference between the venous grafts and arterial grafts is, venous grafts will come for the 10 to 15 years, not more than that. It will degenerate slowly. Why? Because you are connecting the high pressure to low pressure, that will damage the venous grafts. So usually we will check after 10 to 15 years, and 50% of the venous grafts will close within 10 to 15 years. And if the patient had any symptoms, we will do the graft angio. According to the blockages, we will go for the further treatment. So if bypass is indicated by your treating cardiologist or cardiothoracic surgeon, it's better to go for bypass if it is indicated.